Okay, like I said, this is Patricia Potter with Kirkland Solutions. I just wanted to welcome everybody to today's Intermacs and PDMacs monthly webinar. Today on the call from STS, we have Carol Crone, Banu, Emily Conrad, Leanne Jones, and we have Nancy Honeycutt. She is going to be the new STS National Database Manager for Intermacs and PDMacs. So welcome, Nancy. We're excited to have you here today. And then from our core group, we have Neelam and Sylvia Lawden on the call today. Sylvia is going to be giving us a presentation on how to submit an abstract for a poster. So that's wonderful. And then my Kirkland Solutions team today on the call, we have Brandon Singletary. Brandon will be talking us today about some changes coming up with the dashboard, a couple of enhancements that are coming, just a few changes. We have Jeannie Ann Love, John Pennington, and Maceo Cleget. So thank you everybody for joining. And then at the end of the presentation, so after Sylvia does her presentation and Brandon talks for a few minutes to us with a demo, I'm going to go over some data manager survey results. At the end of 2023, we polled you all, did a little survey, and I just wanted to share some of those results with you. So that will be towards the end of today's webinar. And then also, if you have any questions that come up at any point during the webinar, please use the Q&A function. So we have AQO coming up. AQO this year is going to be in Nashville, Tennessee, September 11th through the 13th. Intermacs and PDMacs will be on the first day on September 11th, and registration is open for that. And there is information on the STS website. If you go to resources for data managers and click on there, the very first paragraph is all related to information about AQO, about registering, about the hotel block. The hotel block is at Lowe's Vanderbilt Hotel. So there's all information on there about registering. We have two different options for AQO this year. AQO will be in person in Nashville, and then there will also be an option for buying a virtual pass. So you can see here that if you abstract for multiple registries and want to attend, more than just Intermacs and PDMacs, and you want to, attend adult cardiac, there's a 2-day option, 3-day. And then there is member pricing and non-member pricing. There was early bird, a little bit of a discount for early bird registration, but that has ended. So now it's just the standard rate. So this is the in-person pricing, and all of this is available on the STS website. And then there is the virtual pass option where you will get access to the presentations. And also, if you buy the in-person or the virtual, you'll get access to our Hot Topics webinar. For the past 2 years, we did an AQO Hot Topics webinar after AQO. Sometimes we'll get questions or discussion may come up that we need to take back and discuss internally with the surgeon leaders. And we will revisit those topics at the Hot Topics webinar. So you will have access to that with both the virtual pass as well as the in-person. So here is the pricing for virtual. And then we have started putting together a preliminary agenda for the program. So just to kind of give you an idea of what you can see at AQO this year, we're going to go through the pre-implant and implant forms. We're going to take you through the journey of a patient. We're going to talk about risk modeling, and then we're going to touch on some of our adverse events, specifically major infections, neurological dysfunction, device malfunction, and all of those will come with case scenarios at each of the presentations. And hopefully we'll try and make it interactive so we can poll you guys. What do you think the appropriate way to code it is? So that will all be some really great material. Talk about abstraction strategies, and then using your data. How can you use your data at your own site? So that's kind of what we're thinking the program is going to be. We haven't finalized any topics, but that's kind of what we're leaning towards. And then we have Sylvia Wadden with us today. She is going to talk to us about submitting an abstract. Sylvia she was and correct me if I'm wrong, Sylvia, you were the winner of Outstanding Poster at AQO. The title, I believe, of your poster was Using a Multidisciplinary Approach for the Reduction of Ventilator Hours and Coronary Artery Bypass Graft. So she was the winner. So she's been through all of this before. So she's going to kind of teach us and let us know what we need to do to submit an abstract for AQO. So Sylvia, I will stop sharing my screen, and if you want to share yours, you can.
Two. Okay, can you see it? Hang on just a minute. I want to go on record and apologize that my cat is walking up and down the hall screaming.
No worries.
She's fine. She's not being murdered. That's just her. Okay. Hello, my name is Sylvia Lawden, and I would like to thank the Intermacs team for today's opportunity to speak to the Intermacs user group about how to write a successful abstract. And through the presentation, I'm going to share some of my experiences while working with quality and data management with the cardiothoracic surgery department. And I've also worked with Intermacs and adult cardiac databases now for almost 2 decades. I have presented posters and completed podium presentations locally, regionally, and nationally on projects that I have done utilizing the STS database. I am currently working in quality management as a clinical data consultant. If at any time you have any questions or concerns, please don't hesitate to submit it in the chat. I may not see it right off. We can discuss it at the end, or and just let me know if you have any questions along the way. I have nothing to disclose. So I want to start off with your why. Why are you writing an abstract? Did your site have a change in clinical practice which improved care, or did your site participate in some type of evidence-based clinical process and you want to display the results of your new knowledge? Or do you want to tell us a story about what your team did to improve patient satisfaction or employee satisfaction? But regardless of the information or knowledge that you want to share, please consider submitting an abstract for a podium or a poster presentation to STS. We learn a lot about what we can do and utilize the database by learning from others. So please don't hesitate to submit an abstract if you have something to tell. Now, some of you have never written an abstract or submitted one, and it can be overwhelming, but I'm going to take you through the different abstract structures and break them down individually. And then in the end, I'm going to show you how they all pull together, and you will see how they all tie in together. But we're going to start off by how you develop a title, background, introduction, your method and study population, results, and conclusion. So in the past, I have done submitted posters to Intermacs and STS. I submitted a poster long ago about 30-day readmission rates with LVADs, also to unplanned readmission rates within 6 months of LVAD implant, and that was based on social economic status. I did do a multidisciplinary approach to reduce invent times for isolated cabbages. But the poster I'm going to use, this is very simplistic, but it's very easy to follow through the whole process of writing your abstract. So I'm going to use this one. And this poster focused on a 5-year review of post-LVAD outcomes related to body mass index. And And again, this is the poster I'm going to use as an example. I do want to start off and talk about the title. When we talk about these different structures in the abstract, you want to make sure that you're presenting a clear description of what you are doing and make it interesting for the reader. So with your title, you want something that's clear and identifies your topic, your disease, or your condition, and you want to make the reader really want to read your abstract. So I went to a research evidence-based quality conference, and they had two posters on similar topics and two different titles. One of the titles read Reduced Unplanned Extubation, a Quality Improvement Project. I come from the adult cardiac world, so I was thinking to myself, unplanned extubations, we don't have a lot of that in the adult world. But, hey, let me just take a look at this poster. And then I realized it was pediatrics. Then another poster was Getting to Zero, Eliminating Unplanned Extubation in the Pediatric Intensive Care. And that really caught my eye. You can tell right off the bat from the title that their plan is to eliminate unplanned extubations and that their population is the Pediatric Intensive Care Unit, and their plan is to get to zero. So they already identified what their target is. The next component of your abstract structure is going to be your background or introduction. And this is usually a brief statement of your study's purpose or the current state of research in the field. What's going on, and do you see that there is a problem at your institution that you would like to focus on? So you want to tell your readers why you started the project and what you hope to learn or discover from doing this project. During the process of developing your background and your introduction, they're also going to require that you do a hypothesis question or a purpose question or an aim statement, if you'd like to call it that. So in our case, our hypothesis was developed out of a selection meeting with a cardiologist and the cardiothoracic surgeons. They were talking about the BMI status of patients who were going to be transplanted versus VAD. And there was a belief in the room that patients who had a higher BMI had worse outcomes. So from our scenario of what we were talking about in selection, we came up with, this is an example from my abstract. It's an assumption that the medical community is that patients with higher BMIs are at increased risk for complications post-device implant. So the purpose of the study was to analyze outcomes by grouping patients using BMI at a single center transplant institution. So for the most part, with your introduction, you want to be brief. You want to kind of identify what the problem is. And then also, too, you want to have a clear statement of a hypothesis. And so writing a hypothesis can be a daunting task, too. But I use the PICU method. And if anybody has done clinical research with nursing, this is very popular. Below, I have a reference of where you can get a PICU statement. However, you can also go on Google, and all you have to do is how to develop a PICU or PICU in general. And I'm sure you're going to find lots of references, and you're going to find a number of examples from the different clinical questions and scenarios. I only listed 3 up here, but I think they run between 9 and 12 different scenarios, depending on what your clinical question is in reference to. So like this one, I have etiology, then I have prognosis and prediction, but the one we use the most is the intervention or therapy. And this is like when you're trying to compare one treatment plan to another. So what they're looking for is your patient population, your intervention, your comparison, your outcome, and your time frame. And once you figure out what it is that you are doing and who your patient population is, all you have to do is plug it into these sentences and it writes itself. So I'm going to give you an example. So this is an example of a PICU statement. And for my VAD peers, this is, I chose driveline infections. So my patient population is going to be primary implanted LVAD patients. My intervention is going to be daily dressing changes. What I want to compare is twice weekly dressing changes. And my outcome is going to be driveline infection rates. And my time frame is going to be 6 months post implant. So when we take this information and we plug it into the PQ statement, it writes itself. In primary implant patients, what is the effect of daily dressing changes on driveline infection rates compared to twice weekly dressing changes within 6 months post implant? And it's as simple as that. And it puts the pieces to your puzzle together and it writes that statement for you. So you automatically have an idea of what your scope is going to be for your project. The next part of the abstract is the method or study population. And again, you want to make sure this is clear and brief, but you want to mention all the things that were involved with defining how you did the study. How did you conduct the project? When and where did you conduct the project? Did you use statistical tests, tools, or equipment that you use specifically? This all goes into your method section. Basically, I like to tell people your method, you're basically telling the reader, whoever's reading your abstract or your poster, when they read it, can they replicate your research? Would they be able to go back to their institution and be able to create the same type of research that you did for your project? So I'm going to give you an example from my BMI study. It was a retrospective review of data utilizing the Intermacs registry and the implant institution's EMR after obtaining IRB approval from October 2010 to September 2016. Data abstraction was limited to implantation of primary LVAD patients greater than 18 years of age and who completed a 12-month follow-up. A total of 182 primary implants were included in the study. Patients were grouped according to their preoperative BMI within 6 categories. So that's a lot to swallow. But when you think about it, I'm going to break the method down, and this is all the same information from that same paragraph. What was my design? It was a retrospective review. What did I use? I used Intermacs registry and the institution's EMR. When did I do it? It was October 2010 to September 2016. Who were my patient populations? They were implanted a primary LVAD patient greater than 18 years of age. So they were adults and they had to complete a 12-month follow-up. Also, too, I had a total number of 182 primary implants, and they were all categorized by their preoperative BMI. So I can honestly tell you, I have a horrible habit of putting my results in my method section. But clearly, when you look at this format this way, you can see that results don't belong in here. You're really looking for how you did that study. What did you do? What tools did you use? So the next structural asset of the abstract is your results. And this is where you actually present your summary of your study findings. And we want just the facts. We don't want any interpretation with this. You want to present without interpretation because you want to tell us what you discovered when you completed this project. And I can honestly tell you, it doesn't always have to be, hey, you cured cancer. Sometimes when you complete a project, and even if your results aren't what you expected or as good as you had hoped for, it's still knowledge that you're presenting on what you discovered from doing your project. When you submit your abstract to STS and you write out your results, but you feel you need to provide information, STS does give you the option to either enter a table or a graph or an illustration to help support your results. So again, when you get to your results section, basically what you're doing is stating the facts and what I learned from my project. So again, like I said, you can either put one of the following. You can either put a table. When you put in a table, they do stipulate that it is not to exceed 10 columns or 10 rows. You can put in a graph. I always tell people when you put in your graph, make sure you label your axis, your y-axis, your x-axis. Put as much information as you can. Spell out any terminology when you submit a graph. Or if you wanted to do an illustration, and like this is an example of a chest x-ray regarding placement of a Berlin heart. So for the most part, you can add this, but again, you can only add one of the following. And then finally, you're going to have your conclusion. And this is where you can interpret your results. And you really want to make sure that you relate your results back to your background and your hypothesis. That kind of ties it all in together. That kind of tells you what you were looking for and did you find it. And then also to in your conclusions, this is a good option for you to include any type of limitations to your project. Was there something you wish you could have done differently, or there was a barrier to what you were doing? And then also to any recommendations for future research on your topic. So like with us, with our interpretation, it was like there's a common myth in the medical community about obesity was not validated from our experience. However, interesting findings from our study reveal that there are trends for increased device malfunction in obese individuals. The drawback to our study included it was a retrospective nature, it was a single center, and we had a low volume of underweight and severe obesity groups. And one of our recommendations would have been a multi-institutional study that needed to address the important issues for the whole VAD community. Now, here I am. These are actually from the poster, and I'm going to show you how this all kind of ties back. Again, when you submit your abstract, there is going to be a limit of 250 words. It does not include your titles, your section heads, or any of your author information. But the 250 words makes it really brief and concise. But however, when you get to your poster, if your abstract is already kind of formatted you for your poster, and just now when you go to your poster, you can put more words and you can be more descriptive and you can tell us more about what you did in your project. So these are examples from my poster. So again, this is to elaborate. Now that you don't have 250 words, you can really kind of spell it out. So obesity was discussed as our patient's current body mass index during screening for bridge to transplant and destination therapy for left ventricular assist device implantations. The medical community assumed that patients with BMIs greater than 35 are at increased risk for complications post-device implant. And then from there, I had my purpose statement was to analyze the relationship of preoperative BMIs on post-operative outcomes during a 12-month follow-up at a large transplant center. Then with my method, again, this is where you can see where you spelled it out. So with my method, I have my design of retrospective review, who I included primary implants. Who I excluded, I did exclude pediatric patients and LVADs that were exchange patients. My data source was Intermacs. It was also to the STS adult cardiac database as well as the EMR. My data collection include BMI, demographics, post-operative and discharge outcomes. And then my patients were grouped according to their preoperative BMI classification. And this was defined by the World Health Organization. So I had something that was standardized. And then again, my statistical analysis, I used Kaplan-Meier for survivals and then a chi-square test for post-op outcomes. And then with the results, here you clarify your results. Again, your results are basically what you found. I have graphs on my poster, and if you see the numbers next to my results, each one of these numbers is associated with a different graph. And then also in my results, again, I specified that we had done a chi-square test for postoperative outcomes, and we did not determine any clinical significance. Then from there, you draw to your conclusions. And again, finally, my conclusion, it ties back to the background with the addition of limitations to our study, and then also too for recommendations for future research on this topic. So as I said, it seems like an abstract can be a daunting task, but when you start to kind of break it up, um, you really kind of go through the process and see how it works. And you're just giving a summary of something you did or some project you completed and telling us what you did, how you did it, and well, why you did it, what you did, what you saw, and what you can bring back from it. So it really does kind of tie it all together. If this is your first time or your second time or even my 12th time doing this, I always seek out experts. Find a mentor. If you have a nursing research or a resident research committee at your institution, see if there's somebody who can help you with your abstract or your project. If you have an IRB at your institution, there's probably somebody at the IRB that can give you some tips on how to write an abstract or help review or edit your abstract. Also, too, if you have any academic research faculty that you can go out and seek, definitely have them look over your abstract to make sure your submission is correct in the right format. This is an example of one of my anesthesiologists who works with residents, fellows, nurses, and he's always a good resource for me to get a review from an abstract. He's very blunt. He tells me what I need to do. He edits, my abstracts. He tells me what information goes where. So don't hesitate to go find somebody who is going to take a look at your abstract and give you positive feedback or negative feedback, but just gives you an idea of how you can edit it. For the most part, every time I take a poster or a slide presentation to my surgeons, they always tell me it looks great, it looks good. However, I know they have not read it. They don't give me any feedback, good, bad, or ugly. They always tell me it looks great. You do not want your mother to take your abstract and put it on the refrigerator. You want someone who's going to give you good information, who's going to give you edits where it needs to be done. You want someone who can tell you what's going on. I can honestly tell you, you get in your head and you think, oh, you know the story, but you really need to make sure that that is communicated on paper. And again, when you're doing 250 words, it's brief, it's concise, and it doesn't hurt to have somebody take a look at it. So if you're interested in submitting an abstract, if you go onto the AQO website, they do have where you can submit an abstract. Once you click on that button, it's going to lead you to submit an abstract and review guidelines. Also, too, if you notice, the deadline date is Monday, June the 24th, 2024 at 11:59 p.m. Eastern time. So be conscious of that date. And it also says review the guidelines. Yes, yes, yes. If you're going to submit an abstract, please follow the guidelines. The guidelines are one page. You can go over them. They're very concise. And they also give you some tips on what goes in each area of an abstract. So it's a good source of information. It's about 1.5 or 2 pages. But definitely follow the guidelines, and you must use STS database core fields or participating site. Sometimes they have custom fields. When you're submitting an abstract, you want to make sure you're submitting it to the right audience. And when we read over abstracts for AQO, every once in a while we get a really great abstract. However, it's not related to the STS, or the STS database has not been used. And that's really where it needs to go. Your abstract on, uh, nursing retention, there's probably a conference that it's more suited to. So by all means, direct your abstract related to what you are doing and how you're utilizing the STS database. There's two types of abstracts you can submit: a scientific or a quality improvement. Also, too, if you are submitting the abstract, you're going to be considered the correspondent author. They're going to need your name, your institution, your email, and a phone number. Then you're going to have remaining authors, names, titles, names of author institutions. And when you are submitting this, everybody who is an author on your poster will need to have a disclosure form completed. I can honestly tell you, tracking down the surgeons, tracking down a fellow can be very difficult. Make sure that you know in advance what their schedules are like. Sometimes, I've got them in and out of, vacation, but definitely they need to complete that disclosure form to submit your abstracts. Again, I probably said it 10 times. It's a 250 word limit. That does not include the title, the name of the authors, or the headings. Just be concise and brief. Next thing too is spell it out. I said BMI, BTT, BT, and LVAD. You want to spell it out at least the first time. Not everybody is going to know what BTT is or DT. Some people don't know what an LVAD is, so you have to spell it out. Again, the deadline is June 24th. If you have any questions regarding your abstract submission process, and this is strictly the process, you can contact Emily. There's her email and her phone number listed. And yes, as Patricia had mentioned, I did in 2018. I did get first place for my project for using the multidisciplinary approach for reducing for the reduction of ventilator hours in coronary artery bypass patients. And for the most part, I can honestly tell you, I have probably submitted about, 6, 7, 8 posters to STS. Do not feel discouraged if you submit an abstract and you get a resubmission request. Now that I'm on the other side, sometimes in your mind, as I said, you have read that abstract over and over again. You know the scenario, you live the scenario, you know what you're doing for your project. However, sometimes communicating it on paper can be a little difficult. If the abstract committee does ask you to resubmit, we do not, we're not saying that your project isn't worthwhile. We're not saying that your project isn't worthy of being a poster presentation. We're just letting you know that we need more information. And that's all we're asking. It's not like we're asking you to rewrite your project. We're just asking for more information. And I can honestly tell you, every poster I submitted to STS came back with a request for resubmission. So it happens, but it worked out for me in 2018. If you have any questions or concerns regarding writing an abstract, you can email me at sylvialawden@gmail.com. I do want to thank you for your time and attention for this presentation, and please feel free to contact me by way of email if you have any questions or concerns about writing your abstract. Any questions?
Thank you so much, Sylvia. That was fantastic. I have a question. So for take this poster, for instance. So your source was the Intermacs data. Did you use your reports? Did you use live data downloads? Like, how did you actually get your data?
Okay, with Back then, I was doing both STS and adult cardiac. So what I did is I had access to the adult cardiac, and that gave me the information I needed inpatient. And then for outpatient information, I got it from Intermacs, and they have the downloadable um what are they, the downloadable data sets.
Yeah.
So for specific disease processes such as, what is it called? Can't think off the top of my head. Driveline infections
Mhm.
are neurological events, and we looked only at strokes. You can download that information and you can filter it. If I had some great SAS skills, I could have loaded it up somewhere in SAS. Or now that we have all this new um, dashboards, I could have
Right.
done a lot easier than I did before, but I would download it into an Excel spreadsheet, and from there, filter out the patients that I had used. And then from there, take a look at the patients that were in that 182 list, and then pull them out for 1 year to see where they landed as far as what complications they had.
Okay. Okay. That makes sense. Thank you. Anybody else have any other questions they can think of for Sylvia? You can put them in the Q&A.
All right, guys. Thank you.
Thank you so much, Sylvia. Appreciate it. I am going to share my screen. Oh, Brandon. Oh, I'm on mute. Brandon, would you like to go through the dashboard changes, enhancements now? Is it a good time for you?
Sure, sure. I can do that really quick. Let me share my screen. So good afternoon, everyone. I just wanted to jump on here real quick to share with everyone some exciting new additions to the Intermacs dashboard that we're looking to hopefully release by the end of this month, beginning of next month. We're working on some last minute tweaks to the outcome analytics tool, also known as can be known as the Kaplan-Meier tool. We're trying to match up some of the filters on that to the actual dashboard that we utilize here in order to kind of help y'all be able to go back and forth between this dashboard as well as the Kaplan-Meier tool or the outcome analytics tool if you want to look at more long-term outcomes. But since most of you may or may not be familiar, this is the Intermacs dashboard. This is the main landing page, your reported events tab, which is just going to be your counts of forms that were submitted. This data, again, is updated nightly. So you'll be able to come in and check counts of certain events or patient counts based on this. And in this main landing page here is where we're giving you this new link within the dashboard. Say that you are looking at your adverse events or some of your metrics, and you're saying, well, this is great information. We're looking at, with it, for example, the adverse events, looking at 30-day or 90-day adverse events, but we want to look at something, out to a year or even 3 years mortality. That's what this outcome analytics or Kaplan-Meier tool is used for. So if you just click here, it'll take you straight to that page instead of having to exit out of the dashboard, go, maneuver the web-based data entry, and then you just click create new request, and it'll take you to that. And then if you wanted to then go back to the dashboard, you could, again, look at that. And so some additional filters we've added or we're going to be adding to the dashboard, as you can see here, are this history of MCSD or durable MCSD. So this is just matching some of the new additions to the forms that we are wanting to maintain, which is saying whether or not a patient had a prior durable LVAD or not. Again, this is going to be matched within that Kaplan-Meier tool to have the same filter. And then one of the an additional filter that's been requested over the last couple of years is EGFR. And so we've added that into these groups of EGFR values. So be looking for that, like I said, at the end of this month, beginning of next month, and hopefully these are some additional tools for the dashboard and Kaplan-Meier tool that will help you in your day-to-day or monthly processes.
All right, thank you, Brandon. Does anybody have any questions regarding the dashboard or Kaplan-Meier analytics tool? We have Brandon on the line. If you do, you can put them in the question and answer box and we will get to them. So now I am going to talk about the data manager poll results. So towards the end of 2023, we polled you all on one of these webinars just to kind of gauge who's abstracting, what registries are you abstracting for, how much time do you spend abstracting. So I wanted to share all of those results with you. One nice thing about having these results, one of the nicer things is you can use this information at your center. Occasionally, I'll get questions regarding, FTEs, we're bringing somebody in into our institution to do Intermacs, PDMacs abstraction. How much of an FTE do we have to allot for? How much time is required for this? So these poll results will kind of give you all a good understanding of what the consensus is for Intermacs, PDMacs overall. So the first question was, which database do you abstract for? And 61% of those that were polled were Intermacs. And then the next closest was Intermacs and adult cardiac surgery database at 15%. So that's kind of where the majorities are. The next question is, what is your background? 52% of those that answered the poll are registered nurses, and then it's kind of broken down to advanced practice, nurse practitioners, PAs, other members of the clinical team, and then non-medical QI and IT. And then we asked you all, how long have you been abstracting for? With the majority being about 10 years or more, so quite some time, followed by the next most common was 3 to 5 years. So it kind of, nicely breaks it down. How much experience does everybody have? And then who do you abstract for? So 98% of us are abstracting for our own hospitals, local hospitals, institutions, and then about 2% are using third-party data abstraction companies. And then what is your assigned participant role in the STS national database? With the majority being the primary data contact. So you're probably the site administrator, the primary data coordinator, and then 28% would be the backup site administrator, and then physician representative or. And then how many cases do you abstract per month? So the intention of this question was, when we say cases for Intermacs, PDMacs, how many new implants, how many new patients, or how many new implants are you doing? So the majority is about less than 5, followed by 5 to 10, 11 to 20, and then it kind of dwindles from there. How many hours does it take you to abstract a case? So it looks like 1 to 2 hours. So I would say from what, when I was abstracting, that probably, is most in line with what I remember, about 1 to 2 hours for a new implant. Follow-up's less time, but that kind of just helps to gauge where everybody else is when they are entering a case. What is your timing for abstraction for a case? Looks like most are 1 to 4 weeks after OR date, getting that patient entered, and then followed by within 1 week of OR date. Do you use a third-party abstraction company? 87% was no, 11% yes, and 2% was do not work in a hospital. What source do you primarily abstract from? So most people, it sounds like, are going straight from the electronic health records directly into Intermacs and PDMacs. And how do you abstract data? Right, directly into the database. Some are using paper forms, filling them out, and then putting it in, but it sounds like most are directly entering the data. Do you have a process in place for tracking patients post-operatively, post-discharge? Yep, the majority do. Do your surgeons fill out the operative section or provide information besides the op note? And then the most common answer here is no, they do not fill out anything extra, only the op note. Is your surgeon available to answer questions? The majority, yes. 88% say yes, 12% say no, they're not available. How many cases per year does your hospital perform? And like I said, I think the intention of this question was how many new implants. So it looks like 27 is the most, or 0 to 50 was the most common. And then followed by 50 to 100. And then how many abstractors are at your hospital? Just one person is the most common at 61%, followed by 2 to 3 people are entering data. What was your previous experience? So it looks like the majority were in clinical cardiac surgery, cardiovascular, OR, CV, ICU, perfusion, kind of followed by clinical non-cardiac surgery, cardiology background, medicine, followed by non-clinical but within healthcare. What are your other responsibilities? Looks like there's a pretty wide range here. So just to remind you guys, all of the answers were for your other work responsibilities. Some were not abstractors, others STS, Intermacs, PDMacs, and other STS databases, followed by STS database and other non-clinical responsibilities, STS database and other clinical responsibilities, STS and other cardiology, surgical, non-STS databases, and STS, Intermacs, PDMacs database only. Are you aware of the STS database mentorship program? Looks like majority were not aware of it. We did talk about this a little bit in we had a 2-part new data managers webinar, one in March, one in April. And in the first part, we did cover a little bit about the mentorship program. So hopefully more of you have heard of it and are aware of it now, but it sounds like the majority of you were not aware of the program. And there is information on the STS website under resources for data managers on that mentorship program. Do you find the monthly webinars, quarterly report reviews helpful? Yes, and the amount is on par with what you would like, so that's good to hear. What is your current knowledge level of the STS national database? Most are still learning. I think we're all still learning. So hopefully by attending these webinars, attending our annual meeting, everyone will get more comfortable with it and, we'll just continue to learn. Have you attended AQO in the past? Looks like things are pretty split here. The majority at 30%, no, they haven't attended in the past. 3%, what is AQO? 21% yes a few times, and then 13% were yes annually, and 11% yes frequently, and then 22% yes one time. So yeah, so AQO, for anybody that's new on the call, is our annual meeting. We dedicate about a day to each of the different STS registries. It will be coming up in September. It's kind of what we were talking about in the beginning of the call. It'll be coming up in September. And we have a full day of Intermacs and PDMacs content with speakers, case scenarios, and with each of the presenters, there's time allotted at the end of their presentations for questions and answers. So it's a really great opportunity, especially when we're in person, to network, put faces with names, ask questions. It's a really great opportunity if you are able to attend. If you're not able to attend, there is an option for a virtual pass this year where you will have access to the content. What areas can STS improve upon? So and now looks like the majority at 31%, well, 31% was analysis report education, and another 31% was clinical education. So it sounds like we can improve on our education. 13% basics of the data warehouse platform. So, you know, understanding the database, the app, how to use it. Communication was 6%, 16% pre-analysis data cleanup education, and then 3% with technical support. Rate STS's communication over the past year. Sounds like the majority, you know, people felt was pretty good, kind of on par with where we needed to be. How often do you use the Intermacs training manual? Yes, I review prior to submitting any questions. The Intermacs user's guide, it needs to be, we're working to kind of revamp it, provide a lot more detail, and make it a little bit more user-friendly, align it with the other STS training manuals. So that will be coming probably, you know, shortly. Nancy and I are going to be working on that to kind of revamp it and kind of clear up some data elements that aren't very clear. So that will be coming. How frequently does your physician representative review the Intermacs PDMacs data quality? Things look a little bit split here between always, frequently, and occasionally, so pretty wide range there. How frequently are queries reports run using live data downloads? Okay, good. It looks like occasionally, so that's good. I'm glad you're using your Intermacs data. How often are corrections made to the participant database on the Intermacs DQR? Occasionally. Has your site ever been audited by STS? Looks like most were not sure if they had ever been audited, and then kind of a split between yes and no. Do you perform internal audits on your Intermacs and PDMacs data? Yes, the majority do IR. Have you ever utilized your STS data for QI projects? Yes, that's great. Looks like the majority was yes. For those that joined the AQO Hot Topics webinar, did you find it helpful? Looks like here everybody thought it was helpful, so that's great. The AQO Hot Topics webinar, we've done it twice, and both times we thought it was well received, so it's really great to hear that you did all find it helpful. For those that attended AQO, did you find it useful? Excellent. So yes, everybody that answered said yes. How likely are you to attend an in-person meeting in 2024? So the majority was not likely to possible. So hopefully we'll get to see some of you all there. It's really great, especially when we are in person. Does your institution budget for data managers travel? Looks like a pretty close split here, 50-50, with 53% were no, they don't budget for travel, 47% say yes. Which challenge do you face with in-person meetings the most? Budget and affordability seem to be the majority. Which challenge do you face with in-person meetings the least? Date and length of the meeting was, I guess, not the biggest factor, followed by budget and affordability, location. And then we had polled, where would be, the easiest for you to travel to. It looks like Orlando was popular, followed by Nashville and Chicago. And then which cities were the most difficult to travel to. How much time do you spend completing follow-up forms per month? So this is per month, so not per form. And it looks like kind of a split between 5 to 10 hours to 10 to 20 hours. And then, so that was the end of our poll. So Carol, you think we'll probably do that again, probably towards the end of 2024, and then we can share those results?
Yeah, I sure do think so, Patricia. Thank you for presenting it.
Yeah. I think it's nice to know. It's kind of nice to know, where everybody else stands on things. So hopefully you all found that beneficial. And then I did just want to share our contact information, Carol's information, Nancy's information, and myself. If you guys have any questions, about the polls, the AQO, submitting an abstract, the enhancements coming on the dashboard, anything we talked about today, feel free to email us. Our next webinar will be June 26th at 1 p.m. Central. We're going to have a guest speaker, Dr. Indrani Raja Prayer. She's going to be coming, and she is going to kind of talk to us about the basics of ads. The basics of ads, VADS 101, not everybody on these calls are clinical, or like we had saw on the poll, not everybody has a CT background and, familiar with just the basics of VADs, what an RVAD is and LVAD. So she's going to be coming and giving us a presentation on our next webinar, and that will be on June 26th. So thank you, everybody. It looks like we do have some questions, so I will go ahead and start taking those questions. So first question from Christy. Is there a VAD LVAD implant risk modeling tool in the works? Hoping to have something similar to the other new STS risk modeling tools for other cardiac surgery. Seems like we have enough info in Intermacs to develop one. I have not been able to join this meeting in some time, so forgive me if this has been discussed or if this is common knowledge. Yes, Christy. Thank you. We're glad you're here. Appreciate you joining. Yes, there is a risk modeling tool in the works. And we're hoping to have presentation at AQO this year on that. Next question. This is a question for the AQO meeting in Nashville. How many CE credits for nursing will be given for Intermacs? Emily, do you happen to know?
We'll know that soon. We will be reaching out to our CE company that we work with shortly to get that started. It'll depend on what our program looks like, but our program is slated for the same amount of times that we've had in the past. So it'll be similar probably to what we've had in past meetings. More to come.
Thank you, Emily. And then Tiandra, can the dates of the data included in the dashboard reflect the dates on the quarterly reports to current? Brandon, are you able to take that question?
Sure, I'll try to. I'm not quite maybe understanding the exact request there, but so the purpose of the dashboard was to create a tool that was more as close to live data as possible. So the way that the dashboard is updated is on a monthly basis of those outcomes, and then rolling back the previous 4 quarters. So it is a little bit more active, I would say, than the quarterly reports in that regard, which was kind of the intention of the dashboard.
Thank you, Brandon. Deandra, if that doesn't answer your question, feel free to put more context in the chat. It looks like Mitzi, did you raise your hand? Did you want us to unmute you, or is that just a mistake?
There, your microphone's unmuted. If you have a question, go ahead. Okay.
I'll put, Mitzi, I will just put your hand down, but if you have a question, let us know and feel free to put it in the Q&A. Thank you, everybody. It looks like we're kind of right at time. If anybody else has any questions, I can stay on for another minute or two if you want to put them in. And like I said, our next webinar will be June 26th at 1 p.m. Central. And that we'll have that guest speaker on to talk about the basics of ads.
Great job, Patricia. Thank you,
Great
everybody.
webinar today, Patricia
Yeah.
and team. Awesome.
And thank you so much, Sylvia. Your presentation was fantastic. Really well done. Thank you so much. And thank you, Brandon. And thank you, STS team.
Yes, of course. Thank you, Sylvia.
Thanks, everyone.
Very
Thanks,
good.
everyone.
Thanks, everybody. Bye.
Thank you all.
Have a good afternoon.
You too. Bye.